Hello, my name is Phoebe Wallace, and this is my project on my experience at Pulmonary Rehab at NCH North Naples. While at my internship, I got to achieve many goals, including effectively being able to take blood pressure, the ability to distinguish between different lung sounds like diminish, clear, wheezing, etc., take a patient through a first day orientation of all equipment. I gained a plethora of knowledge from various lung conditions, from COPD to pulmonary fibrosis and so much more. I learned how to appropriately progress a patient through the duration of a program and how to administer a 6-minute walk test assessment. When a patient first arrives to our facility, we go through the check-in procedure. They take their own weight and then we record it. We then take resting heart rate, blood pressure, and assess breathing sounds. And then we provide oxygen tanks and concentrators to those who are in need or are prescribed it by their doctor. The 6-minute walk test is conducted on patients on their first day orientation and then again on their graduation. The purpose of this is to see if they can improve the distance walked over the course of the 18-session program. The program is deemed successful if the patient improves their lap distance by 12% or more. For this test, we gather resting vitals, then proceed to take oxygen concentration and heart rate recordings at least once every minute for the duration of the test. Once the 6 minutes is up, the patient sits and we take peak blood pressure. Then 5 minutes later, we take another batch of vitals to assure that the patient comes back down to near resting levels. The exercise sheet is a prime example of completing the student learning objective of documenting accurately when working with clients. This form stays with the patient throughout the entire duration of their program. It's how we record seat settings, current levels, and the rate of perceived exertion and dyspnea. The treadmill is often the most difficult machine for patients as it's their only weight-bearing modality. This then becomes an amazing chance to integrate the student learning objective of having appropriate motivation techniques throughout the patient's program. The arm ergometer is often the piece of equipment that most of our patients have never seen before. So it takes a little bit of getting used to, but after time, they figure it out. We spend half the time going forward and half the time going backwards. The new step is our most versatile piece of equipment, as it allows us to do 3 different modalities of training. New step arms and legs, just arms, and just legs. This allows me to complete the student learning objective of planning, implementing, evaluating, and modifying an exercise program specific to the physical status of the client. This is one of the 3 forms of bikes that we have at our facility. The upright bike uses the greater trochanter trick in order to find seat setting. Bikes in our facility often cause problems for people with pulmonary disorders because the muscles in the legs use a vast amount of oxygen. This is our resistance training and cool down area. On the right, we have a resistance training video which the patients get to follow along with any weight ranging from 2 to 10 pounds. On the left, we have a cool-down video which the patients follow along before they go to checkout. We also have various resistance equipment, including a leg press and a chest press. Here, I get to complete the student learning objective of creating an exercise or fitness program that integrates the goals and interventions needed for patients.